Understanding chronic inflammation and how to fight it. Chronic inflammation is a silent threat. Unlike the redness or swelling you'd see from an injury, this kind of inflammation is internal, ongoing, and can quietly damage your tissues over months or even years. It has been linked to nearly every major chronic disease, from heart disease and diabetes to autoimmune disorders, Alzheimer's, and even cancer. So what exactly is chronic inflammation? At its core, inflammation is a natural immune response. When you cut your finger or catch a virus, your immune system activates white blood cells to heal you. That's acute inflammation. It's protective. But when that response doesn't turn off, the immune system begins attacking healthy tissue instead. That's when inflammation becomes a problem. Let's talk about what causes it. One of the biggest triggers is diet. Consuming too much sugar, processed foods, trans fats, and refined carbs sets off an inflammatory cascade in your body. These foods increase levels of pro-inflammatory cytokines and free radicals, overwhelming your body's natural antioxidant defenses. Obesity also plays a key role. Fat cells, particularly those around the abdomen, don't just store energy, they release inflammatory signals. The more visceral fat you carry, the more your immune system stays in overdrive. Combine that with a sedentary lifestyle, poor sleep, chronic stress, and exposure to environmental toxins, and you've got the perfect storm for long-term inflammation. And it doesn't always show up clearly. Many people walk around with chronic inflammation without knowing it. The symptoms can be vague: constant fatigue, joint pain, frequent infections, brain fog, digestive issues, even skin problems like acne or rashes. So how do you fight back? One of the most powerful tools you have is your diet. A truly anti-inflammatory diet emphasizes whole, unprocessed foods. Load up on antioxidant-rich fruits like blueberries, leafy greens like spinach and kale, and healthy fats from avocados, olive oil, and nuts. Omega-3 fatty acids from fatty fish like salmon are particularly potent inflammation fighters. And don't forget turmeric, its active compound. Curcumin is one of nature's most effective natural anti-inflammatories. But food isn't the only factor. Regular movement, even 30 minutes of brisk walking a day, lowers inflammatory markers in the blood. Sleep is another overlooked weapon. During deep sleep, your body repairs tissue and regulates inflammatory pathways. Missing sleep, even for a few nights, increases levels of C-reactive protein and interleukin-6, the key markers of inflammation. Managing stress is critical too. When you're under chronic stress, your body produces cortisol, a hormone that, in excess, disrupts immune balance and fuels inflammation. Practices like meditation, deep breathing, yoga, and time in nature help reset your stress response. Supplements can support your journey as well. Omega-3 fish oil, curcumin, ginger, green tea extract, and probiotics have all been shown to lower inflammation in clinical trials. But remember, supplements should complement, not replace a healthy lifestyle. If you've been feeling unwell without a clear diagnosis, ask your doctor to check for inflammation markers like CRP, C-reactive protein, ESR, erythrocyte sedimentation rate, or homocysteine. These tests can reveal hidden inflammation, even if you don't feel acutely sick. The good news is that chronic inflammation is reversible. Your body wants to heal. By making consistent changes in what you eat, how you move, how you rest, and how you manage stress, you can significantly lower inflammation and reduce your risk of many chronic illnesses. Don't underestimate the power of daily habits. The meals you choose, the hours you sleep, the way you move, and even how you think. All of it shapes your inflammatory load. So start today. One small change. More greens, better sleep, deeper breaths, and less processed food, less sugar, and less sitting. Your future self will thank you.